since the legalization of cannabis here in Ontario, Canada broadly, there has been a surge in related schizophrenia cases. My question is, and also we hear this term cannabis use disorder, right? So first of all, let's start there. What is cannabis use disorder?
So cannabis. So there's cannabis use, which is where people are using it recreationally, socially, one-off sort of thing.
Yeah.
For any substance use disorder, it's when you start developing this maladaptive pattern of use. So you can substitute the cannabis in this word for alcohol, for cocaine, any of these words.
So it's more of a behavioral thing.
Yeah. So it's like a behavioral thing where there's functional impairments. Now your life is almost around the use of the substance too. So you are allocating a lot of time to getting the substance. You are spending a lot of money on it. There's functional impairments on your life and relationships. So this is where it becomes more disordered. And we're seeing rates of that increase, I think, as a result as well, too, as the availability of cannabis, specifically within Canada. And, not to jump to the next question, but a lot of the things that we had spoke about is its association with mental disorders and specifically schizophrenia.
Right. Yeah. So I think this is what, from the cannabis, and I'm not agnostic, but, it doesn't offend me either way, whether you use it or you don't. But before legalization, rather, people would claim, it's harmless and nothing bad will come of it. But I guess now we see, the effects, because there is some data to show, as I said, this is surge in these schizophrenia related cases, and especially considering the high potency. I think that a lot of doctors point to that as being the issue. I mean, like the THC content in some of the stuff that you can buy nowadays approaches 30% in just flower itself. And then not to mention the concentrates, which can get higher than that, which is very different from your grandpa's dope of like 5-10% THC back in the day. Do you see a potential change going forward? Is the situation that bad that some of this might be pulled back?
Yeah, I'm not sure if there will be a change. I think the biggest thing is that we need to educate the public so that they're informed of these risks, because I'm all for people making their own decisions, even absolutely. Bad decisions. You're allowed to make a bad decision.
And sometimes those bad decisions are good for you.
Yeah.
When you learn. So, yeah.
But I want to make sure that people are making informed bad decisions.
Yes.
Because what I see clinically, and then even in these research papers, is a lot of young adolescents, usually males, that are using high potency THC daily. And then I see them in the emergency room because they're having persistent psychotic symptoms. And to now connect this to the research world, that was actually done in Ontario by our group and published in JAMA Psychiatry. When you have an adolescent male, I think the age group was 16 to 18 or even 14 to 18, I'm forgetting the exact age range, that has a substance or cannabis-induced psychosis. Within 3 years, their risk of transitioning to a schizophrenia spectrum disorder, so that's schizophrenia, schizoaffective, things like that, is almost 50%. I believe it was 41%. So
that's wild.
If I'm a parent, or if I'm the person that is contemplating, smoking high potency THC regularly at that point in my life, I think I would at least have a second thought about that. If that doesn't change someone's decision making, power to them. But I think it's just something people ought to be informed about before doing that, because schizophrenia is a lifelong disease with very, very poor outcomes for the majority of people. A lot of people don't achieve symptom stabilization at any point throughout their life. They may have periods where they're without positive symptoms like the hallucinations, delusions, but they're left very debilitated by what we call the negative symptoms, where they don't have motivation, they're not able to work, they don't have energy. And this is something that we actually can't treat very effectively. So I think just placing a lot of emphasis on, I can't say definitively that cannabis causes schizophrenia. I do think that there's my stance on it is that there's a genetic preloading to that. But as we discussed before, all of mental health is not just genetics. It requires environmental insults, for the lack of a better word, to result in the development of whether it's depression, whether it's schizophrenia. And they've even done studies for schizophrenia looking at if we took away childhood maltreatment, which can't just remove a variable like that, but if you were to from the population, you could prevent, I think, 36% of schizophrenia cases, speaking to the genetic, but also environmental vulnerabilities. And I'm forgetting the stat for cannabis too, but it was a similar magnitude where if you removed cannabis use, you would remove X% of schizophrenia cases. Not meaning that cannabis solely causes schizophrenia, but it can unearth someone who may be vulnerable and lead to this lifelong, this sort of disease. So my stance is that the literature shows this caution. We're never going to have, I think a lot of the arguments is, I want causal evidence for this. I cannot do an RCT where I randomize an adolescent to smoke cannabis and develop schizophrenia, or to smoke placebo and not develop schizophrenia for ethical reasons, for follow-up reasons, it will never happen. So the strongest evidence that we have are these association studies. And I think we need to make sure that the public is aware of these so that people can make informed choices and not think that cannabis is just very benign. It can be, but it needs to be something that is well informed and supervised for that setting.
Yeah, I think, as I was of the opinion long ago that cannabis was benign, as a adolescent, and as you go through life and you start seeing the effects of people's decision making, friends, acquaintances, and that sort of thing. And I'm definitely, just anecdotally, in my mind at least, it should be used with caution, especially with these high potencies. Do you know? I mean, have you worked with any cases yourself of these schizophrenic breaks because of cannabis use?
Oh, I've seen a number, yes. Both on call and both when I'm working on the inpatient ward of people that are now admitted to hospital with these psychotic symptoms. And then it's always hard, again, to tease out the causality element, but a lot of people with schizophrenia, their index episode is surrounding cannabis use. And even if they're not using it anymore, again, not to put all the blame on cannabis, but if an association and a strong association of that exists, it's pretty alarming. And to refer to the JAMA Psychiatry study, I mentioned the statistic of percentage of people that progress to it. But if we're looking at the risk ratio of a cannabis-induced psychosis and schizophrenia, I think it was 240-fold. You don't see numbers like that for many other data sets. And of course, there's confounders that we try to control for that aren't fully accounted for. The same things you would say for any other observational research. But when you see numbers like that, that is pretty alarming.
So what are the what do the red flags look like of somebody who might be on the precipice of, I guess, a schizophrenic break, but also can you observe somebody and say this person is going down that road, they should stop? You know what I mean? Like symptoms or red flags that you're using too much cannabis or too high potency cannabis. What does that look like? Yeah, if you're a concerned friend or family member, what should you look for?
So I think even before the onset of symptoms, you look for static things like family history. If there's a family history of schizophrenia, the closer, the higher the risk. So if it's a parent, higher risk than if it's a grandparent. You also look for demographic variables. So we know that young males, independent of cannabis use, are already at a much higher risk of developing schizophrenia at a younger age. So that's something. With the cannabis use before symptoms, as I mentioned, higher THC content, daily use are very strongly associated with developing psychosis, but also schizophrenia. And then the other things from a clinical setting is if you're seeing someone using cannabis, fitting the definition of what I described before of a cannabis use disorder, that's more of a high risk. But if you're starting to see functional impairments as well too, say it's an adolescent that's in school or university, something like that, and they're not going to school, they're performing worse, they're losing their friend groups. Obviously, there's other variables that can cause this, but this can speak to a level of functional impairment. If there's elements of psychosis that are coming out, so someone now has a very big obsession with philosophy or something, and this can be normal too. I like to read about things like that, but if it's out of the blue and just seems out of character for the person, can also be early signs. So there's a lot of different signs that someone may be experiencing changes from the cannabis or psychosis, and it's very important that these are recognized earlier on and caught to address things rather than allowing the symptom progression to progress to the point of developing a chronic mental disorder that needs lifelong treatment.
Do you think there should be a higher age restriction on the purchase of cannabis products?
Yeah, I think that. And I also think even things like tobacco or cigarettes, when you buy a thing of cigarettes, it shows you someone with oral cancer or lung cancer or something like that. You have that constant reminder, and maybe people don't take them fully seriously. But I do think for people that are starting to smoke or starting to get into these habits, that could serve as an alarm bell to say, oh, it's not completely just okay. Like there may be some risks associated with it. Because I think sometimes with substances, we villainize some and then we allow some to be natural or safe.
Right.
Because as you alluded to before, grandpa's cannabis is not the same as cannabis today. The THC is very much not natural. It's much higher than you would get in a natural setting. And all these variables have made this natural compound no longer natural in the hands of people that are young, impressionable, and vulnerable.
Right. And with perceived higher value, might even pay more for it, right?
Yeah.